Hey guys, welcome back to my channel. My name is Trey and Happy New Year. I know a lot of people are going to be applying this year, as so am I, and it's going to be a great year. So what I want to dive into was the top 5 paid clinical jobs a pre-medical student can have or acquire. And I'm just going to jump right into it. So my top 5 paid clinical job, I would say is a phlebotomist. So for anyone who doesn't know what a phlebotomist is, they are individuals who work in various health settings or different facilities. They can work in a hospital, they can work in private practice, they can work in all different types of areas within healthcare, and their main duty is to basically draw blood work. So they start IVs and they'll draw blood from those IVs. IV standing for intravenous labs within different healthcare settings. And they can be used in different ways. I think it's a great clinical experience. You'll interact with all different kinds of patients, from pediatrics, geriatrics, adults, different type of patient population, and it could be a really great experience. I would say the downfall for a phlebotomist is it can take about 4 to 8 months to get certified to become a phlebotomist, which can be a huge turnoff to a lot of pre-medical students, definitely if you're trying to go straight through. So, I mean, if you're not, on a really fast track or fast pace and you don't mind taking a gap year or so to kind of get that certificate, that may be something to look into. All right, so my top 4 paid clinical job, I would say, is a CNA. So a CNA basically works underneath a nurse, a certified nurse, a registered nurse, an RN. And the job of a CNA is basically to take the burden off of an RN. And that can be anything from getting a patient water, getting a patient a blanket, interacting with patients, doing everything, I would say, besides like more hands-on, like, giving drugs or, doing extensive type of like health related things, but it still can be great clinical experience for sure. Because CNAs, again, can work in hospitals, they can work in hospice care, they can work in all different type of settings, working underneath an RN. So that can be a great clinical experience for someone who is looking towards to, trying to jump into the healthcare field early on. I would say it takes about 8 weeks to about a year to become a CNA. Again, it's not the most fastest way to kind of jump into the healthcare field, but you are going to get paid. And it can be great clinical experience, and you'll learn a lot. I would say, having RNs around you, you can ask them their insight, different things. It could be really good for someone who is trying to, again, jump into the medical field or try to get a good insight on, a little bit more on the nursing side, just kind of get, that background before start, as you're going through your pre-medical classes. So my top 3 paid clinical experience, I would say, is a scribe. So pretty much anyone and everyone who works in a health setting or is a pre-medical student knows what a scribe is. It's very common. Basically, for anyone who doesn't know what a scribe is, their sole job is to transcribe whatever the doctor is saying. So as the doctor, the patient interaction, they're transcribing everything for the doctor so that the doctor doesn't necessarily have to. And the good thing about this is you'll learn medical terminology early on. So you'll kind of understand the medical lingo between physicians and patients, and you'll get a good grasp on that pretty early on, which can be a huge, benefit. And it doesn't take that long to become a scribe. I think maybe the training, I would say maybe 3 to 4 weeks. It's not that long to become a scribe. So that could be a huge benefit for pre-medical students if you're looking towards to, working. Mainly, I see a lot of scribes working in the ER setting. So, if you want to, get a foot in the door early on, that could be a good way to kind of get your foot in the door and start, learning some medical terminology about also getting really close to the physicians and getting to know the physician on a deeper level, and possibly even getting a letter of recommendation from them. The drawbacks from medical scribe is I believe that some medical schools don't see medical scribes as clinical experience, because you're not necessarily interacting with the patients hands-on. You're observing. And so, technically you can say that's shadowing, but that's not the same thing for all medical schools. And so I just think doing some research into the background of the medical schools you're interested in could be a good way, again, to get clinical experience if the medical school you want to go to, or schools you want to go to, sees it as clinical experience. So it could be a great opportunity there. So my top, I would say the top 2 paid clinical experience is a MA. So what is an MA? An MA stands for a medical assistant. So a medical assistant are utilized pretty much everywhere, from doctor offices, urgent cares, hospitals, anywhere and everywhere. And the main sole responsibility of an MA is to basically take vital signs for patients. So they're the ones that's running around getting, the vital. Their main job is to basically get vital signs. But in my case, I'm an EMT, so I worked at CHOA, and they hired MAs, but they also hired EMTs like me. And what I learned was that MAs, they can train you to do, things that are not necessarily in your scope. So an MA doesn't necessarily draw blood or do phlebotomy work, but if the hospital wants to, or that facility wants to, they can train you in that particular area where you're, in that particular skill, if they want to, basically, or if they feel it's needed for the role in that facility. So an MA can be a really great experience, and definitely you'll have a lot more hands-on. You would do a lot, see a lot, obviously, within the facilities, within hospitals, and it could be really great and beneficial if you definitely like working with your hands. And I believe the training to become an MA is, I say it's still about 7-8 months, I would believe. And again, like, it can be a really good experience. Also you'll be getting paid as well, so that's another bonus on top of that. So, all right, my number 1 paid clinical experience, and you can say I'm pretty biased about it, but hey, I would say is EMT. And so I kind of talked about this early on one of my earlier videos. If you haven't checked it out, or you haven't saw it, you should check it out. So basically, anyone who doesn't know what EMT is, they stand for Emergency Medical Technician. And this, I would say, is one of the longer sides of taking time to get certified, but I would say definitely worth it. It's definitely going to, I would say, separate you out from the typical pre-medical student, which is a good thing, mostly because not everybody's willing to take the time to go get certified as an EMT. But if that's something that you would like, or you don't mind, I would say it's a good route. And what I kind of dived into is, becoming an EMT, it's going to take about, for your basic EMT, it's going to take you about 3 months. And then to get your advanced, which is what I am, an advanced EMT, is take you about 12 months. And so, becoming an EMT, you have a broad scope. I mean, you're not just taking vital signs. You're doing IVs in the field. You are giving medications. I mean, you're treating patients essentially pre-hospitally. And so that alone, you're going to, be thinking on a deeper level as you're treating patients in the field before they arrive to the hospital. And so if you don't, if you wouldn't mind taking time out to, get that, that extra time to get certified, it can be hugely beneficial in your pre-medical journey. I think also you're going to have a lot of, experiences you can talk about on your application. which again is going to separate you from, you know, a lot of individuals who don't necessarily have that, you know, those experiences that you're going to have. And I would say that, you know, I would say you're going to get paid the best out of all the jobs that I, related or I stated. And that's because like your ability to work is endless. I mean, you have mainly you have many different opportunities working as an EMT. I mean, literally the sky's the limit. I mean, obviously not overdoing it with your course load or your other obligations, but definitely you're going to, again, do a lot, see a lot. You're going to interact with a lot of patients, both old, young, and in the middle. You're gonna do it pretty much everything in between. And so that's why I say it's a number one. It is, I want on the longer side of getting certified, but I think that it's going to show, you're going to shine through your application if you decide to become an EMT and then work in the field as you're going through your undergrad classes. So, yeah, that's pretty much all I wanted to talk about. And, you know, thank you guys for taking the time to watch this video. I tremendously appreciate it. If you have time, if you could like, comment, and subscribe, that would be truly amazing. You know, that'd be great. Thank you again, and good luck with your studies.